Hey guys, this is Dr. Hub. Today we look at the orthopedics trauma and the associated vascular injuries. So first is we look at dislocations. So in terms of shoulder dislocation, what is the vessel involved? In shoulder dislocation, the vessel involved is nothing but the axillary. Next, in terms of the posterior dislocation of the elbow. So posterior dislocation of the elbow, what is the vessel involved? It is nothing but the brachial vessel. In hip dislocation, what is the vessel involved? It is going to be the femoral vessel. So shoulder, it was axillary, posterior dislocation of the elbow, it is brachial, and hip dislocation femoral. Then knee dislocation is going to be the popliteal. Now let's look at the fractures. So in terms of the fractures, the fracture of the proximal humerus. So the fracture of the proximal humerus, what is seen? In proximal humerus, it is the axillary vessel which is involved. Then comes a question on the supracondylar fracture of humerus. Supracondylar fracture, and this is going to be of the humerus. So what is the vessel involved here? The vessel involved is nothing but the brachial vessel. So the brachial vessel is involved. Next is the fracture both the bones forearm. So fracture of both bones forearm. So this involves the anterior interosseous nerve, anterior interosseous artery. So previously we saw the fracture of proximal humerus is going to be the axillary. Supracondylar fracture of the humerus is brachial. The fracture both bones forearm is going to be anterior interosseous artery. Next we move on to the first rib fracture. So in terms of the first rib fracture, this involves the subclavian vessels. And moving on to the pelvic fracture. Pelvic fracture, it is nothing but the presacral and the internal iliac. There is presacral as well as the internal iliac. So presacral and the internal iliac. Then the question arises on the fracture of the femur. The fracture of the femur is the vessel involved is nothing but the femoral. Then moving on to the supracondylar fracture of the femur. Supracondylar fracture, and we are looking at the femur. So this is involving the popliteal vessels. Next we look at the proximal tibial fractures. The proximal tibial fractures. So this will involve the popliteal and its branches. So it will involve the popliteal and its branches. Then comes the ankle injuries. So in terms of the ankle injuries, it is the posterior tibial which is involved. So in the proximal tibial, it was the popliteal branch, and in the ankle injuries, it is a posterior tibial.